Hey there, welcome back. We are still here with our three amazing experts with everything you need to know about healthcare enrollment and open sign up. One thing that we were talking about during the break is that right now the U.S. Senate is debating a bill that might have some impacts on people who were unemployed and their insurance. Laura, you want to tell people about that?
Sure. Well, I mentioned before that the bill will help subsidize Affordable Care Act policies for people that make a little bit too much to get help right now. But also, this bill will include money so that if you lost your health insurance by losing your employer by being laid off, it would cover 100% of your healthcare premiums through COBRA. So you can keep the insurance you had through your former employer. And if this goes through the way it's written right now, it would kick in at the beginning of next month and it would carry through the end of September. So you basically would have your insurance covered for a few months at least.
So speaking of prices, people are wondering, is there a cap on the price insurers can charge you?
At the moment, the Affordable Care Act only limits costs if you make under 400% of the federal poverty line. So it's different for every family depending on how many people are in your family and so on. But this bill would lift that cap. So no matter how much money you made, it would be limited to 8.5% of your income.
Okay, all of this can just be so overwhelming. So let's start back at the beginning. Someone had a question here. What is the difference between Medicaid and Medicare?
So there's a significant difference between the two of them. Medicare is the benefit that you accrue or are eligible for when you turn 65. It is intended so that as you move into retirement, you have coverage that will continue through the rest of your life, and you cannot be denied for it when you apply for it. The important thing about Medicare, though, is you have to apply when you turn 65, and you have a window that's 3 months before and 3 months after. And during that time, you have to make some decisions about what benefits you're going to have and how those are going to move forward. And we always remind people that because of the way Medicare is structured, there's Part A, which is hospital insurance. Part B is physicians and outpatient care. And if you do not choose Part B and you go back later, you will incur a penalty that will be there for the rest of your life. And it is a steep penalty. So you really want to understand what you're signing up for in that 65 window. In contrast to that, Medicaid is a completely different benefit that is provided predominantly for lower income and people with disabilities who need assistance for their health care insurance.
Well, I'm so thankful too that you went through all the different parts because people were having questions about those. They want to know right now under open enrollment, can they sign up for another part that they didn't sign up for before?
I'm sorry, I didn't hear the question.
Can they sign up for a different part of Medicare that they didn't sign up for before?
You are not able to just move in and out of Medicaid as you want. That 65 window is a pretty strict one unless you have a disability and you're moving into the 65 plus range, or there is some kind of a qualifying event, but you really need to focus on that 65. And then once a year, Medicare opens up and you can change your policy parameters at times. Some people have moved from Medicare, traditional Medicare, to Medicare Part C, which is Medicare Advantage, which is much more of a network of providers. And then in addition to that, people are always looking at how to supplement the cost beyond what Medicare pays for. So many people will look for a Medicare supplement, and that usually opens up in the fall, in the regular times that we all buy insurance, that October-November period.
So just to be clear, you were talking about Medicare, it opens up once a year. Are we in the Medicare open enrollment right now or just for the other plans?
We are not.
So what can people sign up for right now?
This special enrollment period is for the Affordable Care Act only. So you can sign up for Affordable Care Act plans through May 15th. But you can sign up for Medicaid anytime you're eligible. That's open year round. And Medicare, you sign up within a few months of when you turn 65, or if you have a qualifying event, as Dr. Catherine said.
Someone asked, is there a way to get dental insurance through the government?
There is some dental insurance provided through Medicare when you have a Medicare Advantage program, a Part C program, but that varies from one program to the next. So as you're looking at the program that you're signing up for, you need to look specifically to answer that question.
We have someone saying, my wife will be retiring soon, but I already have health insurance. Would her premium be based on her retirement salary, or would my salary be factored in there also?
For Medicare or an under 65 individual policy?
It doesn't say. Let's try to answer both if we can.
So if you're looking at an under 65 policy and you're trying to get a tax credit, then we're gonna use the household income in that scenario.
And what about for Medicare?
For Medicare, she will have to sign up when she turns 65. It is not available to her just because her husband's made that retirement or that age.
Well, a whole lot to unpack here. Again, our experts are going to stick around for a little bit while longer. Send us your text messages, 336-379-5775. I'm reading some really good questions so far. Keep it up, guys.